Social phobia disorder. Introduction. Definition of social phobia disorder. Social phobia disorder, also known as social anxiety disorder, SAD, is a chronic mental health condition characterized by an intense, persistent fear of being watched and judged by others. This fear can affect work, school, and other daily activities. It can even make it hard to make and keep friends. The anxiety of social interactions often leads to avoidance behaviors and significant distress in social or performance situations. Prevalence and epidemiology. Social phobia is one of the most common anxiety disorders. Studies suggest that about 7% of the U.S. population suffers from social anxiety at any given time, with a lifetime prevalence of around 12%. It often begins in childhood or adolescence, with a median onset age of 13. Females are more likely to be affected than males. Importance of understanding social phobia. Understanding social phobia is critical for developing effective treatments and support systems. Social anxiety can severely impair an individual's quality of life, leading to isolation, depression, and even substance abuse. Raising awareness and improving understanding can help reduce stigma and encourage those affected to seek help. 1. Historical context. Historical perspectives on anxiety and social phobia. Anxiety disorders have been recognized throughout history, but the specific identification of social phobia as a distinct condition is relatively recent. Ancient texts, such as those by Hippocrates, mention symptoms resembling social anxiety, but it was not until the 20th century that social phobia was formally recognized. Evolution of diagnostic criteria. The diagnostic criteria for social phobia have evolved significantly. The DSM-3, published in 1980, was the first edition to include social phobia as a distinct disorder. Subsequent revisions, including DSM-4 and DSM-5, refined the criteria, emphasizing the persistent and irrational nature of the fear. Key figures in the study of social phobia. Several researchers have significantly contributed to our understanding of social phobia. These include Joseph Wolpe, pioneered systematic desensitization techniques. Aaron T. Beck, developed cognitive theories of anxiety. Richard Heimberg, noted for his work on cognitive behavioral therapy for social phobia. 2. Symptoms and diagnosis. Primary symptoms of social phobia. Social phobia manifests through a variety of symptoms, categorized into physical, emotional, and behavioral. Physical symptoms. Rapid heart rate. Sweating. Trembling. Blushing. Shortness of breath. Nausea. Dizziness. Emotional symptoms. Intense fear of interacting with strangers. Fear of situations where one might be judged. Worrying about embarrassing or humiliating oneself. Fear that others will notice the anxiety. Behavioral symptoms. Avoiding social situations. Avoiding eye contact. Speaking softly. Staying quiet to avoid attention. Diagnostic criteria, DSM-5 and ICD-10. The DSM-5 criteria for social phobia include persistent fear of one or more social situations. Exposure to the feared situation almost always provokes anxiety. The fear is out of proportion to the actual threat. The fear, anxiety, or avoidance lasts for 6 months or more. The fear causes significant distress or impairment in social, occupational, or other important areas. The ICD-10 criteria are similar but emphasize the presence of physical symptoms and the avoidance of social situations. Differential diagnosis. Differentiating social phobia from other anxiety disorders is crucial. Conditions to consider include generalized anxiety disorder, panic disorder, agoraphobia, major depressive disorder, avoidant personality disorder. Comorbid conditions. Social phobia often coexists with other mental health disorders, including depression, other anxiety disorders, substance use disorders, 3. Causes and risk factors. Genetic factors. Genetics play a significant role in the development of social phobia. Studies indicate a higher prevalence among first-degree relatives, suggesting a heritable component. Neurobiological factors. Brain imaging studies have shown abnormalities in brain regions associated with fear and anxiety, such as the amygdala and prefrontal cortex. Neurotransmitter imbalances, particularly involving serotonin and dopamine, are also implicated. Environmental factors. Early life experiences, such as bullying, social rejection, or overprotective parenting, can contribute to the development of social phobia. Traumatic social experiences can reinforce fear and avoidance behaviors. Psychological factors. Cognitive theories suggest that individuals with social phobia have distorted thinking patterns, such as overestimating the likelihood of negative evaluation or the severity of social mishaps. These cognitive distortions perpetuate anxiety and avoidance. Developmental influences. Social phobia often begins in childhood or adolescence. Developmental factors, including temperament, e.g., behavioral inhibition, and early attachment styles, can influence vulnerability to social anxiety. 4. Impact on daily life. Social and interpersonal relationships. Social phobia can severely impair an individual's ability to form and maintain relationships. Fear of judgment and rejection can lead to isolation and loneliness. Academic and occupational functioning. Social phobia can negatively impact academic performance due to fear of speaking in class, participating in group activities, or interacting with peers and teachers. In the workplace, it can hinder job performance, career advancement, and professional relationships. Quality of life. The pervasive fear and avoidance associated with social phobia can significantly reduce an individual's overall quality of life. Everyday activities, such as shopping, eating in public, or attending social events, can become overwhelming. Long-term consequences. If left untreated, social phobia can lead to chronic mental health issues, including severe depression and substance abuse. It can also result in long-term social and economic disadvantages due to impaired educational and occupational achievement. 5. Treatment options. Psychotherapy. Cognitive behavioral therapy, CBT. CBT is the most widely used and effective treatment for social phobia. It focuses on changing negative thought patterns and behaviors associated with social anxiety. Techniques include cognitive restructuring, exposure exercises, and social skills training. Exposure therapy. Exposure therapy involves gradual, systematic exposure to feared social situations. This can help desensitize individuals to anxiety-provoking scenarios and reduce avoidance behaviors. Social skills training. Social skills training helps individuals develop and practice appropriate social behaviors. Role-playing and real-life practice can improve confidence and reduce anxiety in social interactions. Acceptance and commitment therapy, ACT. ACT focuses on accepting negative thoughts and feelings rather than fighting them. It encourages individuals to commit to actions aligned with their values, despite their anxiety. Pharmacotherapy. SSRIs and SNRIs. Selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly prescribed for social phobia. They help regulate neurotransmitter levels, reducing anxiety symptoms. Benzodiazepines. Benzodiazepines can be effective for short-term relief of severe anxiety symptoms. However, due to their potential for dependence and withdrawal issues, they are typically not recommended for long-term use. Beta blockers. Beta blockers, such as propranolol, are sometimes used to manage the physical symptoms of anxiety, such as rapid heart rate and trembling. They are particularly useful for performance-related social anxiety. Combined treatments. Combining psychotherapy with pharmacotherapy can be more effective than either treatment alone. This integrated approach addresses both the psychological and physiological aspects of social phobia. Emerging therapies. New treatment modalities, including virtual reality exposure therapy and transcranial magnetic stimulation, TMS, are being explored for their potential benefits in treating social phobia. Self-help and support groups. Self-help strategies, such as practicing relaxation techniques and gradually facing feared situations, can be beneficial. Support groups provide a platform for individuals to share experiences and coping strategies, fostering a sense of community and understanding. 6. Coping strategies. Everyday coping techniques. Practical coping techniques include gradual exposure to social situations, setting small, achievable goals, keeping a thought diary to identify and challenge negative thoughts, practicing assertiveness skills, mindfulness and relaxation techniques. Mindfulness meditation and relaxation exercises, such as deep breathing and progressive muscle relaxation, can help manage anxiety symptoms and promote a sense of calm. Lifestyle modifications. Regular physical exercise, a balanced diet, adequate sleep, and reducing caffeine and alcohol intake can improve overall well-being and reduce anxiety levels. Building a support network. Having a supportive network of family, friends, or peers can provide emotional support and encouragement. Professional support, such as therapy or counseling, is also crucial. 7. Case studies. Case study 1: Adolescent with social phobia. This case study explores the experiences of a 15-year-old high school student who developed social phobia. It discusses the impact on their academic performance, social life, and the treatment interventions that help them manage their anxiety. Case study 2: Adult with social phobia. This case study follows an adult in their mid-30s dealing with social phobia in the workplace. It highlights the challenges faced in professional settings and the strategies used to overcome them. Case study 3: Social phobia in the workplace. This case study examines a corporate professional's struggle with social phobia, focusing on how it affected their career progression and the accommodations and interventions that facilitated their success. 8. Social phobia in different populations. Children and adolescents. Social phobia often begins in childhood or adolescence. Early identification and intervention are crucial to prevent the disorder from worsening and impacting development. Adults. Social phobia in adults can significantly affect their professional and personal lives. Tailored treatment approaches are necessary to address the unique challenges faced by adults. Elderly. Social phobia in the elderly can be exacerbated by other age-related factors, such as physical health issues and social isolation. Specialized treatment approaches are needed to address these additional challenges. Cultural and gender differences. Cultural factors can influence the expression and interpretation of social phobia. Gender differences in the prevalence and manifestation of the disorder also exist, necessitating culturally and gender-sensitive approaches to treatment. 9. Research and future directions. Current research trends. Current research is exploring various aspects of social phobia, including its neurobiological underpinnings, genetic markers, and the efficacy of novel treatment approaches. Innovative treatments. Emerging treatments, such as virtual reality exposure therapy and neuromodulation techniques, hold promise for improving outcomes for individuals with social phobia. Future research directions. Future research should focus on identifying precise biomarkers for social phobia, developing personalized treatment plans, and exploring the long-term effectiveness of various interventions. Conclusion. Summary of key points. Social phobia disorder is a prevalent and debilitating condition that significantly impacts individuals' lives. Understanding its symptoms, causes, and treatments is crucial for effective management and support. The importance of continued awareness and research. Continued research and increased awareness are essential to improve the lives of those affected by social phobia. Reducing stigma and promoting early intervention can lead to better outcomes. Final thoughts. Social phobia disorder is a complex condition, but with appropriate treatment and support, individuals can lead fulfilling lives. Encouraging open discussions about social anxiety can foster a more inclusive and understanding society. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.